In this film, you'll learn, step by step, how to empty your bladder using the Luja catheter. It's important to avoid transferring bacteria from your hands to the catheter. So, start by washing your hands thoroughly with water and soap, your thumbs too. You can use alcohol hand gel if you don't have access to washing facilities. Before you proceed, make sure you have all the equipment ready that you will need for the catheterization. Pull down your clothes to ensure free access during the process. To prevent pushing bacteria into the bladder when you catheterize, you must clean the area around the urethral opening as instructed by your healthcare professional. If present, gently pull the foreskin back to completely reveal the head of the penis. Start wiping from the urethra and outwards. Now prepare the catheter. First, peel the packaging open. You can remove the top of the sticker to reveal the adhesive spot and attach this to a clean surface so you can reach it easily. Take the catheter out of the packaging. If you use a pocket-sized version of Luja, you can give the catheter tube a little twist to unfold it. The catheter is covered by a dry sleeve to help protect it from contamination, so you can take hold of it at any point. Twist to open and expose the catheter tip. Make sure you hold both ends of the catheter upwards, like a smiley face, to avoid spilling the water inside the sleeve. Drain the water through the drainage end into the toilet or sink by gliding your fingers down the sleeve. You're now ready to catheterize. Before you insert the catheter, make sure the catheter tip doesn't touch anything like the sink, your clothes, or skin. If it does, you must use a new catheter to prevent a potential infection. To make insertion easier, lift your penis with your non-dominant hand, as this will change the S shape of the urethra into a U shape. You can apply gentle pressure to the head of your penis to open the entrance of the urethra. But be careful not to squeeze your penis, as this may obstruct the passage of the catheter. If you're a bit nervous, try taking a couple of deep breaths. Being relaxed will make inserting the catheter easier. To control the catheter during insertion, squeeze the soft part of the gray handle. While supporting your penis with your non-dominant hand, use your dominant hand to gently guide the catheter tip into the opening of the urethra. Once it's inside, hold your penis and the gray handle in the same hand without applying pressure to the grip. Use your other hand to insert the catheter. Pinch the sleeve and gradually pull it towards your penis. Pinching the sleeve close to the head of the penis makes the process easier. You control the insertion by pulling the sleeve, while the gray handle allows you to pause insertion and hold the catheter in position. Slowly and gently insert the catheter into the urethra. It's normal that you feel resistance from the sphincter, so be gentle. When you're about halfway through, release the lift of your penis and continue the insertion. If you prefer, you can bend the catheter to hold the urine back until you're ready to drain it into the toilet. Make sure the connector is pointing towards the toilet before the urine starts to flow. Continue to insert the catheter until the urine starts to flow, and then a bit further. Once the urine begins to drip slowly, remove the catheter. You can reclose the product by rejoining the two gray handles. Return the catheter to the packaging and use the rear side label to reclose the packaging. You can dispose of the catheter and the packaging as you would with normal household waste, but not down the toilet. Wash your hands and you've completed the process. Important note: the catheterization procedure should only be carried out after receiving guidance from a healthcare professional. The instructions provided in this film are only intended as follow-up to the advice you've already been given. The Luja catheter is intended for single use only. Before use, always consult the instructions for use document delivered with the products.